Welcome to the deep dive. Today, we're looking at quite a fascinating evolution in medicine. You might actually be surprised that thyroid nodules, they're incredibly common, often just found by chance, with ultrasound. For years, if they caused problems, the main option was surgery. Think general anesthesia, a scar on your neck, and often, lifelong thyroid meds.
Right. But what if there was another way? A way to deal with these nodules without all of that baggage. Our deep dive today is into something called percutaneous thyroid ablation. Well, it's a bit of a paradigm shift, really. The name sounds technical, but it literally just means treating through the skin. Minimally invasive. Our mission here is to show you how this is changing care for, honestly, millions of people. And often it saves the thyroid function that surgery would remove. It's part of this bigger idea in medicine, maybe of less is more, trying to keep your natural anatomy and function working.
Okay, let's unpack that. Percutaneous ablation. What exactly is it? How does it work?
Well, imagine a very fine needle. We guide it using ultrasound in real time right into the nodule. Then, depending on the nodule type, we deliver energy. It could be heat, say, for solid nodules, or sometimes a chemical for ones that are more like cysts. The goal is to destroy just the problem tissue. It's a process called coagulative necrosis, basically controlled shrinking of the nodule.
Okay, got it. Now here's what's probably really interesting for you listening. Why is this such a big deal compared to the traditional surgery route?
Well, the biggest difference is how much less invasive it is. Hugely less invasive. So typically no visible scar. That's a big plus for many.
Yeah, cosmetically significant.
Definitely. And it's usually done with just local anesthesia, often in an outpatient clinic.
Meaning you go home the same day.
Exactly. Same day discharge is common. And recovery time, much, much faster than surgery. But maybe the most crucial part is preserving your thyroid's natural function.
Right. So avoiding those lifelong hormone pills you mentioned.
Precisely. For most patients, yes. And that's not just about skipping a pill. It's about maintaining your body's own hormonal balance. People often report feeling better, more like themselves, less complex long-term management too.
Okay, that makes sense. So given these advantages, who is this best for? Who's the ideal candidate?
Primarily, it's for people with benign thyroid nodules, so not cancerous, that are causing symptoms.
Like what kind of symptoms?
Things like difficulty swallowing, maybe a pressure feeling, throat pain, or sometimes just cosmetic concerns, a visible lump they don't like. It's also really effective for nodules that are overactive, the ones making too much thyroid hormone. We call those autonomously functioning nodules. And interestingly, it can even be an option in specific cases of recurrent thyroid cancer or for certain small, low-risk thyroid microcarcinomas, especially if you really want to avoid surgery.
But there's a vetting process, right? You need to be sure it's benign.
Oh, absolutely. The assessment beforehand is rigorous. It often involves needing 2 separate biopsy results confirming the nodule is benign. Safety first, always.
Good to know. So let's talk about the actual techniques. You mentioned heat or chemicals. How precise is this?
Very precise, thanks to the ultrasound guidance. For solid nodules, the main methods are radiofrequency ablation, or RFA, and microwave ablation, MWA. We use what's called a moving shot technique, basically repositioning the needle tip carefully to treat the entire nodule zone by zone.
And for the cystic ones?
For those, ethanol ablation, or EA, is usually the way to go. It's very effective, uses a simple chemical injection, and it's quite cost-effective, too.
Okay. Now, you're working near important things in the neck, nerves, blood vessels.
Yeah.
How do you keep those safe, especially with heat? Is there a clever trick?
Yes, there is. A really critical safety step is something called hydrodissection.
Hydrodissection, what's that?
Before applying heat, we inject a sterile saline solution, basically salt water, around the nodule. This liquid creates a protective cushion, a kind of liquid isolating region, pushing vital structures like the recurrent laryngeal nerve, which controls your voice box, safely away from the treatment zone. It protects them from the heat.
That's clever. So the big question, what about outcomes? Does this less invasive approach actually work well for patients?
The results are really compelling, yeah. With RFA for benign nodules, studies show an average volume reduction of around 83% after a year. That's significant shrinkage.
Wow, 83%.
But maybe even more importantly for patients, symptoms like pressure or cosmetic issues improve significantly in about 90 to 95% of cases.
That's huge.
It is. And all while typically preserving that normal thyroid function we talked about.
And the risks?
Complications.
Remarkably low. The overall risk is estimated at only about 2 to 3%. And most complications, if they happen, are mild and temporary, like maybe some temporary voice hoarseness from nerve irritation, but serious issues are rare. Just imagine the relief for someone who's been really bothered by a neck lump, maybe for years, and they can get this kind of improvement without major surgery.
Yeah, absolutely. Okay, so if someone is considering this, you mentioned RFA and MWA for solid nodules. Is one better than the other? Well, they're both very effective. Some studies suggest RFA might give slightly better long-term volume reduction compared to MWA, possibly because it causes less tissue charring or carbonization. RFA might also have a slightly easier learning curve for the doctors performing it, but both are good options for solid nodules.
And for cystic nodules?
For cystic nodules, ethanol ablation really is still the gold standard. It works well, it's inexpensive, and doesn't need fancy equipment. Simple and effective.
What an incredible deep dive this has been. Percutaneous thyroid ablation. It's clearly more than just a new technique. It feels like it's fundamentally changing the approach to a really common problem. It really embodies that less is more idea in practice.
Absolutely. And it makes you think, doesn't it? It raises a broader question maybe for you to ponder. As these kinds of minimally invasive image-guided treatments get better and better, how else might this philosophy apply? This idea of precise, targeted therapy that preserves natural function. Where else could it take us in medicine? What could that mean for the future of healing? Maybe more patient empowerment, too.
That is definitely food for thought. We hope this deep dive has left you not just informed about thyroid ablation, but also genuinely curious about where medical innovation is heading next.